Ice cream and sugary desserts are deceptively appealing foods that pose a serious threat to individuals with diabetes. On the surface, they may seem like occasional treats, but their combination of high sugar and fat content makes them particularly damaging. The sugar in ice cream and desserts is absorbed rapidly, causing sharp spikes in blood glucose levels, while the saturated and sometimes trans fats slow digestion in a way that prolongs insulin demand. For a diabetic individual, this dual assault on the body's metabolism not only destabilizes blood sugar in the short term but also exacerbates insulin resistance over time, creating a vicious cycle of worsening glycemic control. The high sugar content alone is enough to raise concern. These desserts often contain concentrated forms of sucrose, glucose, and high fructose corn syrup, which the body absorbs quickly, forcing the pancreas to release large amounts of insulin to compensate. In type 2 diabetes, where insulin resistance is already a problem, this repeated stress gradually impairs beta cell function, reducing the body's ability to manage glucose effectively. In type 1 diabetes, rapid sugar absorption complicates insulin dosing, making blood sugar control unpredictable and increasing the risk of both hyperglycemia and dangerous fluctuations. Equally concerning is the fat content in ice cream and many sugary desserts. Saturated and trans fats impair insulin signaling pathways in cells, directly contributing to insulin resistance. This means that even the body's available insulin becomes less effective at lowering blood sugar. The combination of sugar-induced spikes and fat-induced resistance makes these foods uniquely hazardous for diabetics, as they attack glucose regulation from multiple angles simultaneously. Over time, the repeated exposure to these foods accelerates the development of complications, including cardiovascular disease, liver dysfunction, and obesity, all of which further exacerbate diabetes management challenges. Psychologically, ice cream and desserts can create addictive eating patterns. Their sweetness and creamy textures trigger intense pleasure responses in the brain, releasing dopamine and reinforcing cravings. This can lead to habitual consumption, even when individuals are aware of the metabolic harm. For diabetics, this habit is particularly destructive, as even moderate servings can destabilize blood sugar and promote further sugar cravings, creating a cycle that is difficult to break. The short-term pleasure masks the long-term harm, making these foods deceptively dangerous. The cumulative effects of regular consumption are profound. Beyond weight gain and worsening insulin resistance, frequent indulgence in sugary desserts contributes to chronic inflammation, oxidative stress, and damage to blood vessels and organs. Diabetic patients who routinely consume these foods are placing themselves at increased risk of neuropathy, retinopathy, kidney disease, and heart disease. Even occasional indulgences are risky, as the body cannot process these concentrated sources of sugar and fat with the same efficiency as healthy individuals, and repeated exposures amplify the risk over time. In short, ice cream and sugary desserts are not mere treats for diabetics. They are metabolic hazards. They destabilize blood sugar, increase insulin resistance, promote fat accumulation, and accelerate long-term complications. The pleasure they provide is fleeting, but the damage they cause can be permanent and far-reaching. For anyone managing diabetes, avoidance of these foods is not optional. It is a critical necessity. Each bite is a risk, each serving a potential step toward worsening disease, and each indulgence a silent contributor to serious, life-threatening complications.